Hi, Dr. Wethington.
Hi, Joanne. It's nice to see everybody tonight. Welcome to our introductory webinar, an opportunity to learn about gynecologic cancers, the GYN oncology team here at Johns Hopkins Medicine, and our survivorship program. When people traditionally think about survivorship, they often think of it as something that comes post-cancer, post-treatment, equated with the word remission that a lot of people talk about. But actually the original concept and sort of where our paradigm has swung back to is that survivorship starts from the minute you first hear those words, you have cancer. And it's something that's carried with someone actually for a long time. And many people think actually for the rest of their lives. It was elegantly actually first written about in a New England Journal of Medicine editorial in 1985 by a physician who was a young man and also recently diagnosed with a cancer. And Fitzhugh Mullen sort of crafts and describes what it means to be first diagnosed with the cancer and what it means to be a survivor and sort of his survivorship journey. That concept has grown into a many organization worldwide concept that is carried forth. And our own survivorship program here at Johns Hopkins has many components, from peer support to education to awareness to energetic races that are all geared towards raising awareness for GYN cancers and raising awareness for our gynecologic cancer survivors. In the past, we've had in-person survivorship conferences, and these drew people from more than a dozen states and were wonderful events filled with great education and interpersonal contact. And in the era of COVID, we obviously are no longer able to do these sorts of interpersonal events, but we are hoping that this webinar series instead, a weekly every Wednesday night during September, which is GYN Cancer Awareness Month, will become part of our regularly scheduled programming, so to speak, to invoke a former news reporter. So we are glad that you have joined us. We hope that you enjoy, that you learn a lot. And tonight is really just geared towards introduction. What if we were having a conference you would imagine as that introductory session or that wandering around the halls and meeting people? It's going to be an opportunity for us to introduce ourselves, for everyone who is on to ask questions. So if you are a participant who is listening in and you have a question, you can hit that chat button and join the chat and ask a question, which we'll curate and then pose to the group. But it's an opportunity to sort of set that groundwork, that initial understanding of us and also of GYN cancers and some of the things that we wish our patients knew as they approached a new diagnosis, as they approach ongoing treatment, or as they approach recurrence or that wonderful remission and time period post-treatment. So tonight we're going to start actually with introductions in absolutely no order other than the order that people appear on my screen so that I can keep track. We will start with Brett, who is one of the PAs on our service. Kind of what I've asked everybody to do is give their 1 to 2 minute elevator pitch about them, their sort of professional story, and then give us one fun, heartfelt, interesting factoid that we may not know unless we attended an event like this. So Brett, you'll get to start us off and lead us off.
Okay, I'm regretting being first to the party. My name's Brett. I'm one of the physician assistants with the team. I'm local to the Baltimore area, but I went to Campbell University for PA school, which is outside Raleigh. Let's see, I work on the Weinberg 4B floor. So when you're admitted to our service, you'll be seeing a lot of me. And I guess my fun fact, I have a sand collection. I collect sand from every place pre-COVID that I used to visit.
That is fabulous. That is a very good factoid. Amy, do you want to go next? Amy Brown?
Sure. Hi, everyone. My name's Amy Brown. I'm the nurse manager on Weinberg 4B, so I work with Brett. I have been a part of 4B when I started here in 2005 as a travel nurse and just fell in love with Weinberg 4B and our patients here that I decided to stay and just kind of work my way up. And actually, Joanne's on the panel, and Joanne was my manager at the time, and then she made the decision to hire me. So thank you, Joanne, for bringing me on board. So I went from travel nurse to staff nurse. Anyway, a fun fact about me is that I'm a Maryland native, but I used to live in Montana. So there you have it. and someone's knocking at my door. So I'm at work right now, so I'm gonna mute myself, and I didn't time that. I didn't plan that, but I'm gonna mute myself and see what's up. So take it away, whoever's next.
So a very real interaction. We actually have a couple of people who are going to be popping on and popping off because they are similarly taking care of clinical duties. So you'll see that happen a couple of times. But Dr. Ferris, do you want to go next?
Sure. My name is Stuart Ferris. I grew up in Louisiana. I've lived in, Texas, Virginia, Pennsylvania, and now Maryland. I joined the Johns Hopkins UI Oncology group a year ago, and I'm in charge of the fellowship program. So the physicians who have completed their residency in OBGYN, who are training to do what we do, is to take care of women with gynecologic malignancies. I am in charge of the program that gets them through their 3 years. So that is my role here, in addition to taking care of patients, surgery, and chemotherapy. And let's see, my fun fact is I'm an amateur baker. And pre-COVID, I would bring my work to 4B for people to share, but we've not done that since COVID, which is very unfortunate, and is likely the result of my personal COVID-15 that I'm sure everyone is aware of. So.
Those are great facts. Dr. Beavis, would you like to go next?
I'm Anna Beavis. I've been at Johns Hopkins for over 5 years now. I trained here in my fellowship, and then I stayed on. I'm originally from England. That usually comes up at some point, a few sentences into chatting with me. Let's see, in my role here, I'm one of the attendings, but I also split my time about 50-50 between research in cervical and endometrial cancer and clinical care. And I'm currently working on some grants to fund some more programming for us in our clinic, as well as some kind of research into those two cancers. My fun fact, Dr. Wellington stated it beforehand, so I'm going to use it, which is that I biked to my wedding, but I also bike to almost every surgery that I do because it's good for the environment, it's good for me.
Fabulous. I love that fact, so I'm glad you mentioned it. Dr. Stone, would you like to go next?
Hi guys, I'm Becky Stone, and it's great to see everyone. I am the current division director for the Kelly Gynecologic Oncology service, and as you guys I'm sure know, have huge shoes to fill following Dr. Fader and Dr. Bristow and Dr. Motz, and obviously Dr. Kelly who came before, and you know, really feel very motivated to deliver on, you know, our promise of taking care of the women and their families that we love, and that is really our number one mission, is patient care and service to our patients. And I think that, you know, we have just an incredible team. I actually think we have the best team that exists anywhere, and I am always amazed by them. And I really think, you know, an example of what this team is able to accomplish. You know, we were able to, you know, witness and be a part of, us as providers and many of you as patients, you know, over the last 6 months, you know, during a global pandemic. All of these people on this call here kept, you know, our service line going the entire time, which meant that we did, you know, over 100 surgeries for patients, including radical surgery during the peak of pandemic, the 8 weeks of peak, and gave over 200 cycles of chemo and saw over 1,000 patients just in those 8 weeks. And so that is this team, and I am just so, I feel so blessed to be a part of it. Fun fact about me, I once took my dog to a dog psychic to figure out what type of dog food she liked, and mostly whether she liked vanilla versus strawberry yogurt. I know that seems frivolous, but it actually was very, very informative.
That is perfect kind of fun-filled fact we were looking for. I mentioned earlier that there's some people who are going to be popping on and off because they're taking care of clinical things, and Dr. Levinson is one of them. So I'm going to go a little bit out of order if other people have the same order on their screen as I do, but that's why, because I want to capture her before she has to disappear back into the hospital. So Dr. Levinson, do you want to introduce yourself? We've been doing—
Yes, thanks so much. I'm sorry to pop in, but thanks so much for having this. I think it's so wonderful. And I'm Kim Levinson. So I have been at Hopkins for a very, very long time, actually, because I actually did my medical school at Hopkins and then my residency at Hopkins, and took a short little break to do fellowship elsewhere, but then came back. And so couldn't stay away. Currently, I am the director of our sister site over at GBMC, so our KGOS extension, and I'm out there with Dr. Lou, who you'll hear from, and loving it. So my passion is in cervical cancer research as well, in addition to the clinical work that I do. So my fun fact, I guess I've been known to at least once a year pick up and do a random triathlon. So that's my little fun fact.
That is an energetic fun fact for us. Dr. Lou, do you want to go next, actually, and follow Dr. Levinson, and then we'll sort of have our GBMC cohort?
Great. Can you guys hear me? Perfect. My name is Fong Liu, and I'm the newest member of this awesome team. Just like Dr. Stone was saying, this is such an incredible group of providers that I'm so excited to be joining. I'm coming here from Boston. I grew up in Alabama, and my training has brought me to all different parts of the country, including Massachusetts and California, and excited to be here in Baltimore. My passion is really patient advocacy. I think, and we'll be talking a little bit more about this in terms of what we wish, patients would know coming in. This is part of the series, and I think it's the patients in GYN oncology are what brought me to this specialty. I love taking care of patients through this tough period, and empowering through them through this period. Fun fact about me, I spent some time during medical school in Africa, and I was in South Africa and briefly spent a split second in my car with a baboon because there was food in the car and I had two doors open. And so the baboon was coming in, and I saw that out of the corner of my eye and quickly retreated out of the car. So, fun fact.
And scary fact, all at the same time.
Yes.
I'm glad you got out of the car. Sharon Thompson is one of our nurses and our lead nurse. Do you want to go next, Sharon?
Yes, hi. I'm Sharon Thompson. As Dr. Wethington said, I'm the nurse manager of the nurses that you usually speak to when you call your provider at Johns Hopkins. So that's Nancy and Joanne and Kelly and Dawn. So I am a lifelong Baltimorean. I actually grew up within 1 mile of Johns Hopkins Hospital and lived there until I graduated from high school. And I've been at Hopkins now for 32 years and love it. It's who I am and wouldn't have it any other way. Fun fact is I love to sing. And in my prior life, I was the wedding singer for my church. And I hope everybody has a great time this evening.
Thanks, Sharon. We're going to have you, I didn't actually know that. I think a lot of these other fun facts I might have had a little hint about, but that one's definitely a surprise. So we may be calling on some singing. Dr. Gayard, do you want to finish up for us?
Sure, happy to. I'm Stephanie Gayard. I'm a little under the weather, and so my voice is a little hoarse. Sorry for that, and I may pop on and off as I'm having coughing or sneezing fits. I apologize. I am a little bit different than my colleagues here. Only in name only, I like to say, because I'm a medical oncologist as opposed to a GYN oncologist. And I like to say that really the only difference is that I don't do surgery, and that none of you would want me to do surgery on you. But like my colleagues, I'm very passionate about caring for patients with GYN cancers, and my particular focus is on clinical trials. And for any of you who may ever come to see me in clinic, you know that I will talk your ear off and you will know more about clinical trials than you've ever probably wanted to know. But I'm very passionate about making sure that people are aware about clinical trials and what the role they play in the care of GYN cancer patients. My fun fact is that I don't get much of an opportunity, but one of the things that I like to do in my free time is to turn wood. And what that means is to actually make bowls and things. So here's sort of an example of a bowl that I turned. This is out of cedar. And so it's one of the fun things I like to do when I have time.
I have to say, I could just keep going around and doing more fun facts because these are actually fabulous and wonderful and didn't realize. So I think that's everybody who's actually on. Dr. Fader is, as Dr. Stone mentioned, the prior director of our division and is the one on call right now. And so she is in the midst of clinical responsibilities and so not able to join us. Sharon is on and representing our nursing staff, but as she noted, we have a number of nurses in who help and take care of all of our patients and who all of you know. Joanne is quietly in the corner not saying anything, but there's also, as she said, Kelly and Dawn and Nancy. And we look forward in a few months to having a new nurse join us. So if you see a new face around, we are expecting one more person to join us. Brett is on representing our PAs. Adriana is our new PA who has started recently. So I want to mention Adriana also. And then Amy's representing our Weinberg 4B nurses. And there are a tremendous number of nurses and staff on Weinberg 4B who deserve mention as part of our team and who play an integral and critical role in taking care of our patients. So when you come and meet us and you come and see us in the different settings, these are all sort of the different people who you will meet. And Dr. Ferris mentioned the fellows, and training is a critical part of what we do. And we do have fellows, we have residents, and we have medical students at all different levels of learning in their careers. So none of them are on with us tonight, but I just want to mention them because they are all part of our team, and you will meet them and interact with them throughout your care. And this is true at many institutions. So these roles and these positions are very common, that no matter where you end up getting your care, you most likely will interact with someone who has a similar role. So that ends our self introductions, although I would like to keep going around.